getting a COVID virus and diagnosis of a COVID virus is not enough. Why do we diagnose? Why should we diagnose? Our objective is to know, is it a mild COVID, moderate COVID, or a severe COVID? Here people commit a lot of mistakes. Patients also, some of our doctor colleagues also. They keep on giving medicines for 4 days or 5 days. It is meaningless. We have to create a protocol. That's why I say perfect protocolization for COVID management is the need of the hour. If we don't protocolize, I'm sure our morbidity and mortality of COVID infected is going to be very, very high. We divide these patients into 3 categories, as I mentioned to you, based on the clinical judgment, based on the inflammatory markers, and also based on HRCT chest. So what are the clinical markers? For example, if a person has got an infection, a fever, high-grade fever, and his oxygen saturation is beyond 94, it's normal. It's very mild. We're not to worry about it. But if it is 90 to 94, we can say there is a mild affection. It's also a mild one. But any patient whose oxygen saturation falls below 90 or 89 at rest or even on exertion, like going to the restroom or while coughing or while eating food or while talking, if the saturation comes down, then this patient goes into the moderate category from 80 to 89. If any point of time the oxygen saturation falls to less than 80 or 70, he comes in a severe category. So far as the clinical judgment is concerned, some of faults you should know. People should know how to take oximetry. When we put a check the oximeter for doing the SpO2 estimation, we must make sure that our finger is clean. If there is a water or some food material or some dirt, you may get a false reading. So you have to be very careful. Make sure that you take SpO2 at a rest and not after exertion. You walk for some time and you exercise, then saturation is bound to low. So you have to be very, very careful while measuring the SpO2. And the SpO2 will also give you the information about the heart rate and tachycardia. Fever alone is not an important marker of a very high grade or a severe type of COVID. So first 7 days is very, very important, showing the clinical spectrum of the patients. The last 7 days are very crucial. It is a 14-day disease. First 7 days, fever and all the manifestations which I mentioned to you. In the last 14 days, where there is a cytokine storm. And it is this cytokine storm which is responsible for a very high morbidity and mortality. Please make sure that these patients are treated meticulously by medication as well as by lifestyle optimization. See, for example, if a patient has got a mild or a mild type of COVID, we should be just given simple things like we give doxycycline or give azithromycin 500 milligram daily or twice a day, doxy daily or twice a day, and then we give it these patients as paracetamol or crocin, or we give other medicines like Meftol, any medicines to reduce the fever. If the fever is very high, you can even give 4 hours. You cannot have the protocol of only 3 times a day or 4 times a day. Our objective is to control the temperature. Dolo, 60 to 50 milligram is very commonly used and very effective. We find Dolo is very effective and Meftol is very effective at times. Those who are not responding to paracetamol or crocin. Cough syrup is very important. A lot of people have cough, a very severe cough. So they can use cherry cough or Annex. They're very effective. One can use those steam inhalation, hot saline gargles, and even sometimes they can use what is known as a honey-tuss hot sip. It's like a kada. It's a decoction which contains all kind of mullet tea and other things which are also decongestants. They are very, very good. Can be used by any physician at home. So this is a home care, home isolation. first 7 days is home isolation.